Welcome to 2025, everyone. Thank you for joining me again, and thank you for all my supporters and subscribers on various social media platforms. Just to let you know, if you are on YouTube, where I do have the majority of my subscribers, my presence here hangs by a thread, as I have been clearly instructed that some of the topics that I speak about are no longer allowed. Well, the problem is how can I challenge the narrative in 2025 if I am not allowed to even speak about some of the mistakes and the flaws around the science? And that's essentially where I am in 2025. I'll be focused primarily, therefore, on giving you the answers. So, one of the things is that because I've been researching for so long, and because largely my predictions around the science have been correct for the past 5 years, I also have the privilege of studying it on the ground, seeing and observing and reflecting on what I'm seeing clinically. I know a lot more about what's going on than anyone else. And as a result, I'll have to focus my attention on teaching you how to get around the challenges that we're facing. Because the reality is that this is a really serious issue. And for anyone who has been following me, they will know that I have been primarily focused on autoimmunity. But this is what I think is driving the agenda to silence my science is around this book. Disease X, Are You Prepared? We've had so much support with it. It's still number one in viral diseases. And it is therefore giving an insight into some of the challenges that have happened in terms of the pandemic. The truth is that where we are at the moment, people would rather to walk away from acknowledging any issues rather than identifying what the risks are to the population. You know what it's like? It just popped into my head. It's almost as if you had geologists who were predicting that the volcano was not going to erupt. And so they didn't warn the town or village. The volcano looks as though it's going to erupt, but in order to save face, they can't say that they got their numbers wrong. And so they don't say anything and they just let the volcano erupt. And when it erupts, they just go, well, we didn't realize this was going to happen. This is where we are at the moment in terms of the narrative, because I think it's reasonable to say that no one would have predicted where we are today in 2025. High circulation of virus, huge pressure on hospital systems, excess mortality remaining stable or up depending on where you are in the world. This is a nightmare. And so, one of the critical things about disease X, as I said here, is that you must try and get this. Are you prepared? There is a link in the description. And for those people who don't quite believe, you have a chance here to either purchase it directly, or if you sign up to our newsletter, we'll give you a free excerpt from Disease X just to give you an idea as to what it is that we're talking about when we speak about disease X and why we think that it is so important. So, what we've done is we've incorporated the science into a story format. And that's where the collaboration comes from with Lumientia, is that sometimes if you write just the science, it's very difficult for people to even read it, lest understand it. And so we have developed a system which we had started with our previous book, Humming Heroes, where we took the science and we put it in a story format to make it easier to read for people to then understand what it is that we're talking about. And this is so important at this phase because without the understanding, as I say, around autoimmunity, and you have to remember that when I say autoimmunity, what that means is that the immune system is targeting itself. That's autoimmunity. Instead of it targeting a foreign protein, it then turns on itself. And many autoimmune diseases like systemic lupus, rheumatoid arthritis, multiple sclerosis, lots of diseases like this exist. And very often they can be triggered or facilitated by a viral infection. And in essence, all I have been saying since early 2020 was that severe COVID 19 was autoimmune related, triggered by the virus. For me, it seems pretty obvious, but the truth is that that is not largely accepted by the scientific community. And so, therefore, when I speak about it, it sounds like misinformation. And this is why I've been so severely censored, because the powers that be, they can't explain it, but they know what it is not. And where have we seen that happen before? Where there's so many things these days where you're hearing, we know it's not this. We don't know what it is, but we know it's not this. Excess deaths are up. People ask questions. And this is where I came around with the elephant in the room. What was the cause of it? And this is why I had to come up with this meme, because I couldn't say it directly. And the answer is we don't quite know exactly what it is, but we know it's not related to the elephant. That's the kind of science that we are facing at the moment. And in 2025, the hard challenge is how to hurdle over the censorship, try and give you some insights into the science, and most critically, to try and direct how it is that you can make and protect your health in the longer term. Because sadly, it does genuinely seem that the powers that be are not actually that interested in your health. They're interested in you doing things for your health, but not actually in your health. And that's very sad. And so therefore the problem is what do you do? How do you approach the future when all that is being offered are more interventions to manage symptoms rather than a deep understanding of disease? That's where I'm different. I genuinely am focused on understanding the primary pathophysiology of disease. And to demonstrate that point, that's why I developed this COVID 360 course here. And this one here is almost 60 modules. It's that I've put it on a New Year discount, but it's showing you all aspects of the research that I had been looking at: autoimmunity, autoimmune responses, upper airway mucosal immunity. It covers everything that I think is relevant. And so it is a huge course. And I did it partly because I needed to remember the fundamentals of the science in order to be able to not forget it. Because as we move forward, some of the basic things are oftentimes overlooked. So if you're interested in that, that's also in the description. But what I'll be doing is building on that science to try and predict and explain why disease manifestation is occurring. And as I said, I can't be open here. And so you will find that I am very cautious with my words. If you want me to be clearer, you have to join things like my Substack, or even if you're on Rumble. And most importantly, make sure that you join the newsletter at the link below as well if you're looking at the book. But here is the fundamental, and this is now where we get back to the science. And when we had done our research in early 2020, and we published in May of 2020, saying that severe COVID-19 was autoimmune related to ACE2. And we had wanted to do that research, but we couldn't get the funding for it. Some of it was done in October of 2020. I thought it would have been obvious at that point. But for some reason, it just kept on getting overlooked. And now you will find a lot of people will talk about COVID, but they still can't explain the cytokine storm. And so if you want to scratch beneath the surface, what you have to ask people when they start to spout on about, well, it's just this and it's just that and this is how it works, ask them, well, what is the mechanism of the cytokine storm? And do we see it typically in all other viral infections? Now, it can happen, certainly in influenza, it can happen. But say, for instance, influenza primarily causes virus related damage with secondary bacterial infection. And that's primarily the mechanism. But the cytokine storm was really unusual. Clinically, we have never seen anything like this before, not on the scale that it had occurred. And so, if you can't explain it, I just don't understand why anybody would discount any thoughts, especially the questions about autoimmunity. And here was the research that was published in March of 2024. This was technically the research we wanted to do. And they did quite a comprehensive thing looking at autoantibodies to ACE2 and immune molecules associated with COVID 19 disease severity. And in case you don't understand, and actually I just realized that sometimes I assume everybody has seen all the slides and so on, and so they know what I'm talking about when I talk about the infection of the virus. Just a quick point here. What you have there is this is the coronavirus with the blue things being the spike protein. On the surface of the gray ball, you have some red dots. Those red dots are the membrane protein, and the yellow orange is the envelope protein. And then you have on the right the cut section of the virus, where it looks at the nucleocapsid protein inside. And the critical thing about the virus is that the spike protein is the driver for most of the pathology that we see. And the question is why? Why does it do that? And part of that question was what I was focused on in terms of the mechanism of it binding to ACE2, the spike protein. And I think that I'm just thinking, I want to show you something if I can find it quickly, because I think that this is just an important piece of the puzzle. So I'm just looking for it. But the main point is that in terms of how the ACE2 interacts with the ACE2 interacts with the virus, let me just show it to you here. So again, you can see the spike protein on the surface, and the cut section is blown up with that prefusion spike glycoprotein S1. And to the right hand side of it, that's where it would bind to ACE2. And most of the research was about what happens when free circulating ACE2 binds to that spike protein. Does it then get caught up in the autoimmune response? To me, it seems like basic question. It's not even complex, and so I don't understand why that's not pretty obvious to everyone. And the research showed here that you had, and this is the research from the paper, um, ACE2 IgG autoantibodies here. And you can see now this is very important. And I just looked back at this today. But in severe disease here, you can see that this is elevated. The ACE2 autoantibodies that's targeting ACE2 are elevated in severe disease versus mild or healthy. And in all the cases, you have elevated autoantibodies to ACE2. So it clearly means that this autoimmune process is occurring. However, this is a really important question that I don't yet have a full answer for. But what you see here is that in the healthy and in mild disease, you still have autoantibodies present. They're just at lower levels. It's just much more elevated in terms of severe disease. Now, this is a really important question. And so, in order to try and answer it, what I did is I went back to the paper and I just thought carefully about what it was that they did. Who did they look at in terms of their methods? And this is what I found. And what you found here in terms of the human participants, they took healthcare workers from their children's hospital. They were enrolled, and this was first time this was looking prior to the administration of the mRNA COVID vaccine, the Pfizer BioNTech. So they collected plasma from the blood at the baseline, week 0, and then after the week 7. looking at people who had either no infection or people who had infection and no hospitalization. And it was mostly middle aged white females who were used in this study. And now, this is really important. The critical bit is that these were healthcare workers. The timing, I couldn't find the exact timing, but I knew that once they were talking about the Pfizer BioNTech, that means that it was probably early-ish, maybe March of 2021, because the vaccine was available and they were starting to vaccinate healthcare workers. So this would have been around that time. And what it indicated to me is that the healthcare workers, the reality is this: it was not possible to not be exposed to the virus if you are a healthcare worker. We now know how transmissible this virus is. And even with the best masks in the world, there is still a strong possibility that everybody who was front facing, especially early in the pandemic, where we didn't even have masks at the time, and some people would argue whether or not the masks were necessarily so effective and so on. Just remember the principle: anything that reduces aerosol transfer. So if somebody sneezed on you and you breathed it in and they were infected with anything, your risk is higher than if they were at a distance or if they sneezed into their arm or their shirt or into a handkerchief. So it's just really simple principles about the amount of viral load that your immune system can deal with. But even with that, you would still have exposure. And basically, my thought at the end of that 1 year was that everybody who was frontline in whatever, whether it was a supermarket, whether it was a bus driver, they would have been exposed to COVID 19. And they would either have had natural immunity because they already had the infection, even if they didn't have symptoms, because in a lot of people, 40 to 60%, it's asymptomatic infection. It doesn't mean that they didn't have it, or better yet, subclinical infection. So, with that in mind, I want you to look back at this image. So, when we look back at this image now, this was therefore taken in 2021. And even in the healthy, there were ACE2 autoantibodies present at the lowest level, but they were present. So, my view is that this represents the fact that everybody was exposed. And what it indicates, if I'm right, is that even on minor exposure, it triggers an autoimmune response to ACE2. Now, listen very carefully, because this is now where it gets very important. And this is part of the challenge with predicting what happens next. I've always said that the big challenge is to prevent the virus from getting into your bloodstream over and over again. Because based on that, it means that it will trigger autoimmune responses on every infection. And that's where the priming of the immune system makes it therefore an increased risk. And that's where I'm coming from in trying to predict the understanding of how disease presentation will occur. Because once you understand that, and if anybody's clinical, just think about it. If you understand where ACE2 is located, brain, especially the brain stem, and so, if that's the case, you may see unusual patterns around brainstem symptoms. People may have unusual double vision, or dizziness, or, even ringing in the it's stuff that doesn't add up to anything and then seems to resolve on its own, may suggest ACE2 autoimmunity. The heart, the kidneys, so you need to look out for that. The certainly the lungs, but the lungs have so much capacity that it may not necessarily, unless it's a severe disease, trigger any symptoms. But certainly that's what I'll be looking at, trying to find ways to advise people as to, once you understand the pathophysiology, what does it mean? How do you then try and manage the ongoing presentation of disease? And just a final point at the beginning here. is that this is looking at IgG autoantibodies, or IgG, yes, autoantibodies here, and IgA for healthy versus severe COVID 19. And wherever you see red, that tends to indicate that these are autoantibody epitopes with autoantibodies. And you can see for severe, significantly higher levels than it is for the healthy. But as I said, this healthy represents people who have already been previously exposed. And here is an exercise for those, again, who may be questioning the autoimmune theory and they say, well, I haven't really heard about that, and so on. Just do a simple search on ACE2 autoantibodies. Just use Google Scholar and just look before 2020 and see how many papers you find. What you will find is that there really wasn't very much at all that noticed ACE2 autoantibodies. So these ACE2 autoantibodies are almost specific to COVID 19. We've not really seen it in any other disease. And that's one of the reasons why I think it is so very important. But it just raises the point that where we are now is about, forget about all the politics. As I said, for 2025, I'm focused on the science of trying to help people who may be affected. If you have no problems, I'm not sure if there's anything else I can help you with. It's good to talk about the science. I can't talk about anything controversial. However, when it comes to finding solutions for you or your loved ones to be able to understand, to know what questions to trigger when you're faced with the healthcare system, when nobody knows what's going on, that's when it's the worst for patients, where, if something is not right, nobody can find anything that's going wrong, and, the person is just left there to struggle on. That's where the issues and the understanding about autoimmunity then become so very critical. So, this is just really a touch base to prepare you for 2025. And as I said, in 2025, we're searching for answers. We're looking to understand disease. We're looking to find manifestations. And so, in that way, remember that one of the starting points is about disease X. Make sure that you click on the link below, even if you aren't yet purchasing it, but we're still number one and we anticipate the support. You can join our newsletter. As I said, this is important if you want to stay in contact with me, just in case I am completely disappeared. By subscribing to our newsletter, you will always have at least once weekly newsletters and information, which is far more to the point about my thinking and research. And you will find links here to purchase on Amazon, as well as some of the testimonials. So please, as I said, I'm encouraging people to do this process, because that's how you can stay in contact and make sure that you hear the unfiltered thinking and challenges that I have, as we have many coming up in this next few months, as we had the super spreading over the winter. Now is the time we're going to see unusual disease. You're going to need to be able to understand it. Have a great evening.